Let me welcome you to this session. My name is Michael Nutter, former mayor of the city of Philadelphia and also past president of the U.S. Conference of Mayors. And I'm glad to be here with all of you on a critically important topic facing all of us across communities, small, medium, and large, across the United States of America, if not around the world. And that is, of course, the issue of flavored tobacco products, whether that's cigarettes or vapes or other methods of delivering ultimately nicotine. These products, I think as many of you know, are primarily targeted and marketed to young people. And so as a part of the effort in conjunction with the Campaign for Tobacco-Free Kids, there is an effort to create a support group, Mayors for Healthy Kids. Group of mayors coming together to place emphasis and focus and raise awareness on the issue of the targeting and marketing of these products, almost all of which are illegal in the United States of America, targeted at our young people. I have an incredible panel here this afternoon, and in no particular order, Mayor Van Johnson from Savannah, Georgia, Mayor Michael Coleman, former mayor of the city of Columbus, Ohio, Dr. Mariah Ramander, and all of them are going to introduce themselves, but an attending physician at Children's Hospital and a professor at Northwestern, Jennifer Forsythe, who is a parent advocate, and DJ Yearwood, 2023 National Youth Advocate of the Year Award winner. We have some examples, not samples, but examples of product that were purchased, I believe, within a mile of where we are right now. And they'll be passed around for either your tactile or sensory experience. There's also this quite unique, you probably can't really see it. There's a backpack here. Many of us are familiar with backpacks, and some of them have that little tube that comes out for you to sip water. Well, this one you can vape from. This is a vape backpack. And so our young people, if they had one, you think that they're hydrating, and they're actually vaping. And their parents and or teachers in school would never actually really know. This is the level at which folks in the tobacco industry are going after our young people. For myself, and I was asked by one of the mayors who said, like, is this what you do for a living? No. As I mentioned, I'm the former mayor of the city of Philadelphia. I got involved in these kinds of issues 24 years ago. When I introduced the wildly, almost insane at the time, issue of banning smoking in enclosed places, offices, restaurants, bars, and the like. At the time, of course, the big tobacco said, you know, that people would lose their jobs, revenues would go down, puppies wouldn't have food, you know, I mean, the city was going to slide into the Delaware River, none of which happened. And just yesterday, actually, there was an article in the Philadelphia Inquirer, this summer, 60 new restaurants will open somewhere in the course of the summer into the fall in the city of Philadelphia. And no one in most places could ever imagine going into a place now and people would be smoking. And so that's how I got involved in this issue. 6 years fought with big tobacco on to get that legislation passed. Today, as I mentioned, we're going to talk about flavored tobacco products, vaping, cigarettes, and a whole host of other things. Nearly 2 million high schoolers is estimated, and of course you know in any of these surveys there's always an underestimate, but nearly 2 million high schoolers acknowledge that they are using e-cigarette products across the United States, 90% of which are flavored products. If this conversation was taking place yesterday, I would have said that there are only 23 authorized products by the FDA. Today, though, there are 27 authorized products because just this morning, the FDA approved another 4 products for sale. It is estimated that there are 15 15,000 products in the marketplace, and as of today, only 27 of them are actually authorized by the FDA. These illegal products are all over our stores, small, medium, and large. They have tremendous repercussions for the health of our young people, but these companies have received virtually no repercussions for having these products in their stores and available for sale to our kids. When you see the things that go around, you'll see some of them have really cute names like Elf Bar and Puff and Jewel and all kinds of things. Sound really cute, sound really safe, right? These are nicotine delivery products. Vaping products contain as much nicotine as a full pack of cigarettes. These are dangerous, they are illegal, and they are, in many instances, that is how young people start. It's also about the use of menthol. Science, of course, not only indicates that menthol creates that soothing effect, which is actually masking the damage that nicotine does to your lungs. It's affecting young people at large, and of course then moving into the adult market. We have a very quick video to put particular emphasis on this issue, and then we're going to come right back with our panel. So if we could roll that, what did I say, roll tape?
The problem of e-cigarette and vapes has been probably one of the greatest challenges we've faced. When we installed the vape detectors and the alarms started hitting our phones, it was shocking.
Vaping has added to the teachers' burdens of needing to constantly scan the room, scan pockets, scan bags. We're becoming the vape police.
I'm shocked by the number of teens I see who are vaping daily or even vaping continuously. All of them are using minty fruit flavors.
The problem is rampant by race, by gender, athletes, non-athletes. It's a great burden on the school because it's something we have to deal with daily.
Administrators can confiscate anywhere from 1 to 20 vape pens in a day.
Students are trying to leave the classroom or they're disengaged. You see them struggle. It's detracting from their ability to pay attention and give us their full potential.
The products that are on the market have extremely high levels of nicotine, and young people's brains are particularly susceptible.
Some of the symptoms that we're seeing, chest pain, elevated heart rate, shortness of breath. As a mom and as a nurse, it scares me half to death.
There are many who want to stop and can't.
Kids are going to extreme lengths. Addiction's real.
It's pretty hard for some of them to treat them appropriately because their level of cravings are so high. That's something we see in people who've smoked cigarettes for 20 years, and I'm hearing it from 7th graders.
It breaks your heart as an educator to see these students.
I don't know what their future holds if they are this young with this high level of addiction.
We've got to do something to try to combat this.
We know for a fact that menthol in cigarettes has been a particular item targeted at the black community and many communities of color. This is a campaign that Big Tobacco has been on for 60 years, targeting the African American community in that way. And we also know that nearly half of young people who start smoking usually start with menthol cigarettes. The FDA must end its policy of non-enforcement, of selective enforcement, and actually go after these illegal products on the market. Let's hear from our panelists. Quick introductions up and down the line, and then we're going to jump into some questions. Mayor Johnson.
Well, good afternoon. My name is Van Johnson. I'm the mayor of the city of Savannah, Georgia, and so honored to be sitting in between two of mayor legends. If there are goats in the Bear book, these two Michaels are them. So I'm just honored to be here about a subject I'm quite passionate about.
Mayor Coleman.
My name is Michael Coleman. I'm the former mayor of the city of Columbus. And like Mayor Nutter, I was the mayor when we adopted an ordinance 20 years ago to ban smoking in restaurants and public places. 20 years later, the current mayor, who is also the president as of tomorrow, president of the United States Conference of Mayors, he and I and City Council and Tobacco-Free Kids passed an ordinance that has become the center point of the battle between the health of kids and big tobacco. And that ordinance provides that all flavored tobacco products, including menthol, shall not be sold in the city of Columbus. Wow. The state of Ohio twice passed a law preempting that, and the governor, who's a Republican, vetoed twice that preemption statute. They did it again. And what happened was on the second veto, the legislature overrode the governor's veto to ensure that there was a preemption of state law allowing for menthol and flavored tobacco products in all cities, that cities had no ability to enforce. We took it to court. We weren't done. The battle had just started, actually. And the court supported cities, overturned a preemption effort, and now we're running through the courts of law in the state of Ohio. I am assuming it's going to get to the United States, to the state Supreme Court. But Ohio and Columbus have become the center point where the stakes have been and have been drawn and been placed in the ground between big tobacco and the health of kids. And I'm glad to know that Columbus is taking a lead in that regard.
Dr. Ramonda.
Hi, everyone. I'm Mariah Ramondar. I am an adolescent medicine pediatrician in Chicago at Lurie Children's Hospital and an associate professor of pediatrics at Northwestern. And I am here on behalf of the American Academy of Pediatrics section on nicotine and tobacco prevention and treatment. I am really excited and sad also to be still talking about this. We really should have gotten rid of flavored tobacco products across the board, and particularly in e-cigarettes a long time ago. And, this should be done at the federal level, but this really is a local issue right now, and it is, really important for us all to be taking up this fight at a city level for sure. So thanks.
Jennifer Forsyth.
Hi there. My name is Jennifer Forsyth. I'm from Portland, Oregon. I have 3 kids. I've been working for about 17 years in the behavioral health field as an administrator. I'm working with PAVE, Parents Against Vaping e-cigarettes, as a volunteer, and I'm happy to be here.
Hello, my name is DJ Yearwood. I'm from Kansas City. And I was the 2023 National Youth Advocate of the Year for the Campaign for Tobacco-Free Kids.
All right.
Thank you. And I just like to say, my journey in youth advocacy has started in this issue. It started with realizing the impact that this issue has on the entire educational system, especially in the urban core, impacting students who look like me, students from my same background. And so I'm excited that we can talk about it, and that there's so many people who can help take on this issue across the country.
I love that DJ didn't wait for the introduction, jumped right in, and then started talking about what he wanted to talk about. That's why he was a youth leader. And I'm going to stay with you. DJ, share a little more about how you got involved in this work, any impacts that you've seen, whether with your peers or even how this particular issue may have touched you or your own family.
Yeah, so in 2018, I was in middle school, and that's when I started to see the increase or new prevalence of my peers sneaking off to the bathroom or putting their hoodies over their mouths or whatever the case may be. And At that time, I really wanted to be a lawyer, and so there's this really cool program in Jackson County, Missouri, called the Jackson County Youth Court, where I could go volunteer as a youth attorney in cases, in low-level cases, to help my peers out who had been charged with a low-level crime. Now, I was surprised to find out that on a docket of 80 every 2 weeks, 60 of them would be charges for possession of tobacco and nicotine products. Now, that's extremely shocking to someone who just saw, a few friends, but knowing that that students from across the Kansas City area, from across the county, are using these products, so much so that at least 60 of them get caught every 2 weeks and sent and referred to this youth court. That's disturbing. But here's the story that I like to tell that really gets me is it was near the end of the school year, and this little girl, this young black girl, had been charged with possession of a vape, and she was, I believe, 9 years old, in 4th grade, I believe it was, and she had been kicked out of class. She had gotten OSS, and I'm like, what made you feel like doing this? Why? She said, I didn't know it was bad. She hit the vape in front of her teacher's face because she didn't know that it was bad. She told me she thought it was flavored air, which I believe her, right? She had no fear of it. And so all of this whirlwind of punishment just came at her, which sparked my passion. The fact that tobacco industry has not only caused this jump in addiction and crisis, but they're also causing this exacerbation of almost a school to prison pipeline, right? Where you're targeting young students, particularly urban students, black and brown students, toward getting them into this chain of punishment for health defects or for health matters. And so that's what sparked my my passion for this advocacy.
Thank you. Thank you for sharing that. And Jennifer, as we keep kind of coming down the line, parent advocate, please share your story. How'd you get involved? Impact that you've either seen with others or possibly your own family as well.
Sure. So I noticed, I think my son was freshman, sophomore in high school, kind of a little bit of change in behavior, discovered these devices or the packets that I had no clue what they were, started, asking him about it. He would kind of brush it off. It's nothing, Mom. I'd never seen them, had no familiarity with them, so I started researching, found out what they were, stumbled upon PAVE, the organization that is against the rise in vaping, and just saw, over time, my son, a little bit of change in his behavior, motivation, less focus on, sports and academics, mood swings, all of these things that I, in hindsight now see that was all being contributed to by the vaping. He's now 22. I think he's been off the vaping maybe 3 months, but bottom line is I think it's once they get started and get hooked, which he said he was hooked in about a month, it's just nearly impossible to get them off of it. It's so addictive. So I got involved with PAVE just to learn more, hopefully help others, educate myself, educate my kids, express to my son the dangers. But again, when you're addicted, it's just so hard. Even though you know it's bad, to quit is very hard. So that's what led to my involvement, and I hope I can help in some way.
Thank you. Dr. Raimondo, you're at a children's hospital. I think generally we don't even know the real impact, longer life impact of these products, but you're in the here and now, and you're seeing what's going on with our children. Please talk about it from your perspective.
Thank you. And I think the stories that we've heard from Jennifer and DJ are the stories that I'm seeing in my own clinic of, I'm the medical director of a substance use treatment program, and a lot of our teenagers are dragged in by their parents, for when they find them, smoking cannabis and things like that in their house. But I have teens who are begging for help around their nicotine use because it's so powerful. And once they've tried it, nicotine, just the impact on the brain, sends you towards addiction so much faster than a lot of substances that it gets out of hand. And our teenagers always feel like, oh, they've got this, we can handle everything. But we see with nicotine that teens are recognizing that it's so powerful they can't stop. And so, I see teens who are having trouble paying attention in school because they, have felt like they've had to leave to go to the bathroom to vape, or vape in the middle of class with their, secret backpack and things like that. That this is something that a lot of their friends are doing. So even if they want to stop, their friends doing it, and it's so easy to just share that and pass that back and forth. And then, we see people with coughs and asthma exacerbations, and, but I think really the truly scary part is that, we don't know what this is going to do long term. Things we know is the earlier you try something, the more likely you are to go on to have a problem with it. So that these products have been targeted towards young people, and we just saw a slight increase in tobacco use among middle schoolers. That's such a concerning problem, because this is when, youth is when people become addicted. Everybody pretty much who has a tobacco use disorder or smokes cigarettes as an adult started as a teenager. And so this is a big problem.
Mayor Coleman, I didn't know that story, but I think it bears a deeper dive, and I'd like to go more to the beginning of this effort in Columbus, and certainly whether elected officials, mayors, policymakers, activists, just people who care that we're fortunate to have in the audience. Give us a little more on the genesis of the effort, how you got involved, then Mayor Ginther got involved, the advocates, opposition, challenges that you face. This is not easy territory. You and I have talked on many occasions about our battles with big tobacco. They are rough, they are tough, they don't mess around, they spend millions and millions and millions of dollars fighting against folks whose mission is to make sure that our citizens are safe, that they're secure, and that they're healthy. And they will come at you kind of morning, noon, and night. So give us a little more in depth on the issue.
Well, let me start off by saying we have a lot of mayors in the room and representatives from communities around the country. It is our job as elected officials to take care of our young people, to ensure that they're protected from harm that may happen to them. And it is the job of big tobacco to addict them. It is their job to make as much profit as possible. And that is the battle of the titans. Who's going to win that battle? And it is an obligation of the cities and the mayors to protect our kids. So this goes back 25 years for me. I was addicted to tobacco, menthol. It almost killed me. And I was just starting my role as the mayor of the city of Columbus, and I was so excited and ended up in the hospital. And I thought I was going to have to get a tracheotomy one day. And I said, Lord, you get me through the night, I will never smoke again. The Lord listened, and I complied. And I said, if there was any way I could impact on fighting nicotine addiction, which I was an addict myself, I would do that. So we had the Columbus ordinance on banning tobacco and usage or smoking in restaurants. But then one day TFK called. TFK said, look, we're interested in putting together, and that stands for Tobacco-Free Kids. We're interested in putting together an effort that would ban menthol cigarettes. I said, well, I was a menthol smoker. And flavored tobacco. I said, well, you know what? That's a tall order. let's do a study first. You know, we always start with a study, right? So we studied the city demographically. And here's what we found out. And this is going to be the case in your cities as well. That we looked at the highest incidence of cancer where it was located. We looked at the overlay of the highest incidence of breathing problems. What's it called? COVID? The highest incidence of diabetes. All those things that could be traced back to tobacco usage. And guess where they were located in? Black communities, low-income communities. And then we went back and we looked at where are these flavored tobacco products and menthol products being sold? And we plotted each and every location. Guess where they were sold? In low-income and black communities. And guess what else? Within a block or two of schools. So kids having to walk past these stores that fill with aroma, and they're attracted into these corner gas stations and these drugstores, and they see where it used to be in my day to have candy lined up on the rolls. It is e-cigarettes, flavored tobacco products, menthol products. And you know what? It attracts those kids. And that information in itself went a long way in convincing the city council, and the mayor was right with us the whole way, Andy Ginther, who's now the president here, and we banned it. But I have to tell you, it was a fight because big tobacco came in with all their might, all their money, hiring this person, that person. They hired police officers to come in to say this is going to result in brutality of kids on the corner, all this crazy stuff.
Over-policing.
Over-policing. Yeah. It's ridiculous.
Of course it is.
This is a healthcare issue. This is a health department issue, not a police enforcement issue. And we had hearings all over the city for over a year. They shipped in retailers from around the country. We had one hearing. They brought in 500 retailers from Texas, from Arkansas, from Wisconsin to come to Columbus and bang on the doors and the windows of the buildings we were having these hearings in. It was unbelievable. We prevailed, and the state legislature, as I just told you before, attempted to preempt our efforts, and the governor, who was a Republican and is a Republican, very child-focused governor, supported us in every way. So the battle is at the street, it's in the cities, and when you decide, and I hope you decide, to step up to help with this effort as a national movement, understand that you have a battle in front of you, and it's going to be tough, but your job is to protect your children and your families.
Mayor Johnson, unlike Mayor Coleman and I, you have.
What do you expect me to say behind that?
You have a real job.
What do I say behind that, though?
Well, I'm creating.
Drop the mic. He's finished.
I'm creating some space for you. I'm trying to let some time pass. Bro, I got you. Unlike sitting between the two Michaels, you have a real job. You right. You have a real job. You are the mayor. We're formers. Tell us your experience in Savannah, things that you're seeing, what your folks are dealing with on the ground, and how do you, as a current leader, try to deal with these issues?
Again, thank you. To put it in context for me, I remember fondly growing up, and my life, the best part of my life was about sugar. sitting in front of a TV with a big bowl of cereal. And it was just nothing like it, just sitting there. And I could eat like boxes of cereal. I mean, just watching cartoons, I could just eat boxes of cereal. But I needed my parents to know better for me than I knew for myself, because all I would eat would be the sugar. And then you look and you see where now how they place sugar in restaurants. They put the really cool cereal, they put it at kid level, and all the healthy stuff they put it at adult level. And now you see it was really part of a much bigger conspiracy. Ladies and gentlemen, now the stakes are much higher. And I don't know, these things are going around, and I was smelling it. It smells good. It looks good. It's very attractive. It is a form of terrorism, intelligent terrorism, because they are appealing to your sensory means, to immature minds that don't know how to adequately process that which they're taking in by their senses, especially the grape one. Who has the grape one? Hold the grape one. Who has the grape one?
Well,
There's a great package going around. Don't tell me you took it.
Who
took the great package?
They were
The great
examples.
package is gone. Well, they took it as a sample. Somebody's gone with it.
Yeah.
But wherever it is. But
Yeah.
I mean, it smells good. But yet we lack the maturity in our minds to reconcile the fact that that which we're seeing that looks attractive, that what we're smelling that smells attractive, is not good for us. Which is why we need caring adults and ultimately institutions to be able to help protect us from ourselves until our maturity catches up with our senses. And so here we are, and in Savannah, we've been a smoke-free city since 2010. We were the first city in Georgia to become smoke-free. And we need to step that game up, because we recognize that this level of intelligent terrorism is for all the stakes, because they know that once they're hooked, then they don't really care about where it goes from there. We know now, and I'm not a doctor, but I did stay in Lowe's last night, that even addiction is on a trajectory. We know it introduces you, and then it's not enough, and it grows, and no one wants to take the responsibility for letting people into the door that create the addiction. And so, I mean, being able to sit next to, in between very bold mayors, and again, I can't say how honored I am to be among people who've given us templates just to be badass and just go hard and fight a state or fight the world and just be about the principles of getting stuff done. For us, it allows us a template to be bold, because we want our young men to grow to be old men. And we want them to have the ability to have dreams and visions and live those things out and live their best lives, but they can't do it with lung cancer. They can't do it with all of those variety of bronchial issues that occurs from vaping. And so those of us that know better have to be able to do better. And so sometimes parents need that help even from their governments. We have to keep our people safe from bullets. We have to also keep them safe from vaping. And so I've been honored to be a part of this under the leadership of these great mayors and these great organizations, because we recognize that this is an all-in fight. When the enemy is fighting you with everything they got, you just can't come with just a ground game. It has to be air, ground, sea, and you have to have some brave soldiers to go in there and take the fight back to them. And beloved, I believe that our young people are worth that fight.
There you go. Drop the mic. There you go. Okay. All right. So we're done. No. Speaking of our young people, DJ, I want to come back to you with this question, and then just open things up to the panel, and then we are going to open the floor. We want to hear from you, DJ. From your perspective as a young person, what do you think some of the misconceptions about e-cigarettes may be, the things that young people may think they know that are either, not true or don't know?
Yeah, that's a great question. So I think that some of the first obvious things are what we hear all the time, that vapes are better than cigarettes, that vapes are different from cigarettes, that they are a means of stress release or some sort of relief of whatever you've got going on, or that it's just vapor, like that fourth grader thought, or that it's easy to quit. The thing I laugh at every time I hear it, it's not funny, I just hear it a lot, is I could quit if I want to. No, you can't. And that's the thing that we have to really enforce is it. I hear it so often. And so, but I think it's part, misconceptions, and part they know it and they don't care, right? Because using these products, and by the time they've found out this information, that they're more addictive or they're already hooked, and they no longer care that these may be worse than cigarettes. So they no longer care that they can't get off of it. And so I think it's a two-parter that keeps them hooked, both misconception and then the fact that these products take away their motivation, like Ms. Forsythe said.
Yeah. Doctor, same question, and then I'm going to come to Jennifer.
Yeah, I think that it is certainly a lot of misconceptions, a lot of marketing, a lot of really intentional packaging and flavors on part of big tobacco that really trying to make these not cigarettes and big tobacco out of the goodness of their hearts created more products so that people could stop smoking. Yeah, right, they want more customers and they want to hook you young because that's when they know you start using these when you're young, you're gonna be a lifelong customer. And so it's, I would say I don't worry about my patients not caring. I am worried they are addicted and they want to stop and they can't. It is like they thought it was flavoring and they just tried it. And then, these products now, it's thrown out there that, Juul used to be a pack of cigarettes. Some of these are multiple packs of cigarettes in one of them. There's so much nicotine. The nicotine that they've created is being delivered in new ways that get you more nicotine than a cigarette does. So that doesn't taste as bad as cigarettes, doesn't taste as bad as the products that were out there, 7 years ago. These, they're always trying to find new ways to keep you using and make it so hard to stop. And yes, and I think that we're here with gloom and doom here. We are here being like, oh, it's terrible, everybody. Fortunately, most teens are not using, okay? So this is not inevitable. We can stop this and, people can grow up healthy and people can quit. Wonderful example here, but it's so hard. And teens, especially who start using, have to try multiple times to quit. And that's exhausting. And, so we've got to do what we can to stop this.
Jennifer, if you could give us your view on the question. Obviously, you're a parent advocate, but I'd really like to better understand, quote unquote, some of the common misconceptions that even our parents may be making about these products, if you have a view on that.
Yeah, I can only speak for myself, just that in the beginning, I did not know what I didn't know. So when I saw these things, I did not know what they were. Maybe they were less harmful, or maybe they were just a passing fad, or maybe it was just he got caught up in the moment with a party and peer pressure. So, but as I dug deeper, I think that part of the attraction for our kids is that they're small, they can hide them. Do them when you're not looking. Some of them are odorless. So that makes it very hard as a parent to stay on top of it. But the misconception, I think, is just a lot of parents I don't think are in the know, or they think like I do that it was a passing fad or peer pressure, or their child said it was something they tried and they'll never do it again. But now that I'm wiser and that I think a lot of my friends have gotten wiser. They know that if they are seeing their kids with this, it's a serious problem.
Doctor, I appreciate what you said about a certain sense of doom and gloom. I think everyone up here is, we are all the ultimate optimists, but we're also realists about just what's going on out in the marketplace. And I think certainly the example that Mayor Coleman has laid out and what Mayor Johnson is currently doing as the mayor are all signs that there is a fight to be fought. It is not hopeless. This is, we don't have to just accept it. But because we're all realists, we do really want to share that these are tough fights, right? I mean, we're not like trying to stop the opening of a water ice stand. We're talking about an industry that knows for a fact that they have a product that kills their customer. And they make money. But as was said, they need a constant churn of customers. This is the same industry that denied that smoking was bad for you from the 50s and 60s. And then the United States Surgeon General stepped in. This is the same industry that denied that secondhand smoke was bad for you. This is the same industry that keeps developing these products, that goes after constituencies based on their likes and ups, whether it's the menthol content or, as the doctor said, the nicotine content. They are strategically, surgically, chemically going after folks for this product because they know we will hook you. You may go on to other things. You can die from this, and so we need a constant source of both products and revenue to keep this thing going. This is what we're dealing with. It is huge money, multiple interests, and we want to encourage all of you in a call to action to take on this fight, but we want you to know as best we can from our own experiences what you may be jumping into. One of our panelists said it the best, though, but it is worth the fight because these are our children. I'm going to open the floor. Please identify yourself if you have a question, if you want to direct it to a particular panelist, or just open, and we can figure out who's going to respond. Yes, sir.
Hi, Khalil Sarin, Mayor of the City of Cleveland Heights in Ohio.
Welcome.
My question has to do with what we do next. We know, for instance, we all know at this point what ALEC does and how they're funded. Where are the resources for mayors like me who, if I start drafting a resolution or an ordinance prohibiting the sale of these products, it might be difficult for me to sit down and do that myself. I could probably get it done, but it would be a lot easier for mayors all around the country if we had things like sample legislation that we could provide to our councils to consider, and samples of sort of the supporting documentation. Yeah. I know that there are fact sheets, but specifically the laws that we need to pass and create a critical mass, for instance, in Ohio, to add on to Columbus's success and Cleveland's success in getting these things passed. Where are those supports for us?
Well, I saw in my peripheral vision that Mayor Coleman has already put his mic right up to his mouth. So I was going to answer, but I'm going to give it to the leader over here because I get a full 360 view. Go ahead, Mayor Coleman.
Okay, thank you. Well, I have the model ordinance. And you're in Ohio. You're right down the street from us, or the highway, and I'll be glad to share it with you. But I would not recommend that you just introduce legislation. Yeah. I think that is, that what will happen is big bad tobacco, and they are big and they are bad, will come into your community and make your life hell. Right. And your city council. And they will sue in a minute. They're probably preparing a lawsuit against me just by calling them big bad. I don't know. But at any rate, what you should do, I think the strategy is, as we did in Columbus, we spent almost a full year seeking allies, support in the community, and education in the community. Right. So, and we kept it sort of undercover because we knew if Big Bag Tobacco knew we were out there doing this, they'd show up. So after we locked down the support of the community in black churches, organizations, NAACP, Urban League, this organization and that organization, we spent an enormous amount of time of educating and preparing them for the war to come. Then the ordinance was introduced. Then the war began. But they had no place to go because the community already supported our proposition. And they were talking, they came to council, they screamed and hollered, they brought in people from all over the country. It was ridiculous. They were laughed out the city. See ya. Bye, Felicia.
My God.
So I wouldn't recommend, I wouldn't recommend just going right at it. Yeah. I think the community needs education first because a lot of parents really, they see it, but they don't understand what it is. You got to explain it to them. It is an epidemic in our schools. Our schools were right on with this right away because they collect boxes and boxes of this paraphernalia in their schools. It's not permitted, but they didn't know what to do about it. But they were right there with us. So that's a good place to start is in your public schools. And the suburban areas have this problem as well. It's everywhere, but they sell it in the black community. Folks in the suburban areas come to the black community to buy it.
Mayor Johnson.
I think data is important.
Yep.
And not only can your local county health department in Georgia, the county health departments, the CDC, the data is there. And as you're building allies, you build the allies with the data and make that case because in the end, the facts are going to be the facts wherever they are. And you're able to extrapolate that data to your area where people are very, very clear. So data is important, but also personal stories are important. When you have a couple of people that people know that can say, hey, I was addicted, and I could have lost my life, that means something. As the policy is being developed, I think it's the connection of not only data, but also the storytelling side of it. And again, you have the campaign for tobacco-free kids that has a plethora of information that they have gathered. And there might be cities that are that's like yours that they can help to compare you to. I think, the biggest thing is really just being courageous to do it because it's not easy. It's not easy. Not only do they make a lot of money, they give a lot of money.
Oh, yeah.
They give a bunch of money. And so people want, and every now and then they're going to call in on those investments. But again, it's the right thing to do. And I think, Mayor is absolutely right. I think after a time when you've prepared your best shot, by the time it's all over, you have allies that say, no, we have to do this.
Yeah. I agree with everything both of the mayors have laid out. And Mayor, thank you for stepping forward and wanting to get engaged. I was going to certainly say you're right here with the national experts in the campaign for tobacco-free kids. When I started my effort in 2000, I don't know who introduced whom to whom, but I came upon them, met Michael Berman, was working with them at the time. He's working with us now on this effort, and we started with our health department. So I was a city council member at that time. This is before I became mayor. And we had public hearings on the issue. That's like Mayor Coleman was talking about. If you have your own health department or if there's a regional or a state or whatever the case may be, I feel fairly confident that the health department is probably going to say, this is not good for kids, right? So you start with an immediate support group and an ally because I want you, Big Tobacco, to now fight with my health department. And we'll let the public figure out health department, Big Tobacco. Health department, Big Tobacco. Who should I be listening to on this issue, right? So you kind of start with that. The models, you can go back to all the smoke-free efforts. We weren't the first ones to do smoke-free. We benefited from what New York did We benefited from what New Jersey did, and other municipalities and states, even just around us. The opposition, you never see them. I mean, they're almost invisible, but you see the effects. They will create an opposition group in your city of well-funded people who will give you the most inane, insane stories of opposition as to why this is a bad thing. Again, people are going to lose their jobs, this and that, revenues, enforcement, the police, this and any other thing. Of all the things that Philly PD could be worried about, vapes are not one of them, okay? So, I mean, you just had to brush through all of that nonsense. But there is strength in numbers. There are a number of entities that have gone down this path, either prohibiting smoking in buildings or now menthol, vaping. You know, this is the next wave of this whole thing. And so there's a lot of support out there.
One last thing real quick on what they will do, to the extent that they will go, big bag tobacco. This did not happen in Columbus. I think it was in Detroit, if I'm not mistaken. Big tobacco went to a prominent pastor in the black community and wanted to pay, and did in fact offer a $200,000 contribution to his back pocket to come out against banning of flavored tobacco and menthol and all that.
Yeah.
To this great man's credit, he stood up and said, Big Tobacco tried to bribe me to come out in favor of them, and I refuse to put my people in jeopardy. They'll go to that extent and further to overturn what you're trying to accomplish. They came to Columbus, same thing with different sort of ways. But that was the most visible thing that I've seen them do in another city. Now, am I right about that? Is it Detroit? Oh, doggone it. It was 250,000, not 200.
Don't try to short them. Don't try to short them. Next question.
Hi, Brian McGill from Altura. Quick question. And I jumped on the late, so forgive me if you covered this. When you look at curbing flavors and getting these into the hands of young kids, I look at my own state in Massachusetts, which has completely gotten rid of flavors, right? So now it's original, it's basic menthol, whatever the case may be. One, has that helped at all? Has it worked? And I think a second part to that question is, what tactics have you seen to be the most successful to start really kind of inhibiting the candy flavored versions of these, in other jurisdictions?
Go ahead, Doc.
Okay, I'll say that yes, getting rid of flavors makes a difference, and it will make a difference. And it might be hard to really see that effect because Massachusetts is surrounded by other states where it's available. But don't let that argument stop you from doing the right thing. You know, in your cities, they'll be like, oh, they'll just go across. That's always an argument. Please, let's all band together and let's, not just not do it because it's the right thing because they can do it somewhere else. Who cares? Do the right thing, and it will make a difference. But it will take time to really see that. We saw tobacco 21 laws. Now that's the law of the land, but that took time in different places, and it makes a difference. Fortunately, these youth are accessing illegal products because all of this that you see here is currently illegal. But they're not, when it's not available in stores, this isn't something they're seeking out other places. This does decrease initiation. So pricing also makes a big difference too. So taxation,
Right.
which is, we all love that, I think, here in your cities, then that does that, prices out. Youth are sensitive to that increased price. So there's definitely different ways to do this, but we feel pretty confident, I think, that getting rid of flavors, that's what's luring them in, is gonna stop initiation.
And I'll also add really quickly that that from what I've seen and from what I hear from my peers, not only here in Kansas City, but across the country, and even from that video that was played, 89% of youth who are using these products are using flavored products, right? So that fourth grader would have never touched that if it tasted like a cigarette, right? And that's the appeal to young people now, is that these products look like something different, right? Cigarettes are bad now. They're the thing of the past. They're for old people. Whatever you want to say. But whatever you want to say.
He's talking about you again, Mike.
But what we do know is that they're not the cigarettes are not appealing. However way you want to twist it, they're not appealing. And so when you get tobacco flavored vapes, I can just imagine a number of my peers who use these products, and some of them have actually told me when I've asked, that they wouldn't use them if it weren't for these flavors, and especially not the little kids who are. I forgot to mention that this fourth grader that had originally had that vape that got me started in this advocacy had a Cinnamon Toast Crunch flavored vape. And so back to your cereal, Mayor Johnson, these things wouldn't have never attracted them.
It's just disgusting.
If I may, Mayor,
It's just disgusting. Yes, sir.
Don't underestimate the intelligence of youth. I found when we did it in 2010 with our secondhand smoke, youth led that campaign. Young people want, when they're given the right information, they are very effective, very passionate advocates, and they're influencers for their friends. No tobacco company is going to come and rip down the kid. They'll rip down the mayor, but they're not coming after kids. And so I think also educating young people, I've learned when you educate a child, you educate their parents as well. And so there are young people that are very concerned about their future. And I think if you're able to provide, there's so many resources out there that you can really arm young people with good information that they can become very, very valuable allies to you.
One last
More
Go
thing.
ahead. Sure.
One more thing on that. And like I said earlier, a big part of this issue and a big part of why I care about this issue so much is what comes of it. It's the fact that in a lot of schools and a lot of districts, this is treated as a health issue or an addiction. It's treated as a crime. And students are tired of that, right? Even the students who are addicted, they feel like they cannot make it through an entire 45-minute class period without hitting these vapes. That's an issue for them, right? They don't want to go to OSS for that. But not only that, if they are suspended and they're sent home, they're not going to leave the vapes at the door. And so I think that this is an entire thing. And like Mayor Johnson said, I think young people are the key in this fight for a lot of reasons. And the biggest one is that they're tired of the effects that it's having on them. They're tired of the effects it's having on their peers. They're tired of being punished for something that they feel like they cannot control. And when there's a vape shop across the street, whatever lit vape shop across the street from your school or middle school that will sell to you, and you want to fit in with your friends or whatever, this is something that they really don't care to keep around as long as it's not inhibiting their health. So I think that Mayor Johnson is right. It's absolutely, they're key players in this.
One last question. Right there. Yes, Mayor.
Thank you. I'm Mayor Debbie Nash King from the city of Killeen. So we had this item on our agenda to ban tobacco shops that were by schools. And the biggest argument was that all the 7-Elevens and all the other stores that are around the school, they are selling it. So if there's 1,500 products out there.
15,000.
15,000, and only 27 is approved by FDA. Why we as a conference do not take this to the federal level to fight it, because every city does not have the financial means to fight. I'm from Texas, so I can just tell you it's red. It's all red there. To fight that on the level that other cities can, because the biggest thing that we heard, because we work closely with our schools, is that they're buying it online anyway. So That's a big fight. Even if we do try, it didn't pass because they were afraid. Like I say, we're all red, and they have friends. It may not be the big tobacco company, but people at different levels saying, hey, don't vote for that. So they want to get reelected. This is just a city of 150,000 plus. So why are we not fighting it all together as mayors? Because like you stated, regardless if you get the city buy-in, the financial means to support it, we don't have it. Thank you.
Mayor, thank you. Look forward to your leadership. And one of the things that is a hallmark of the U.S. Conference of Mayors is to take positions on national issues, raise our voices, use our presence in any way, shape, or form that we can. So probably a little too late for tomorrow, unless somebody has something in the...
No, I can tell you, last
What's
year
happening?
in the city of Columbus, when the conference was in the city last summer, the USCM voted unanimously a resolution to present to the federal government, the FDA in particular, to support the banning of menthol cigarettes and flavored tobacco products. So the United States Conference of Mayors already weighed in. And so what we need is for the FDA to, first of all, enforce its own rules, number one, and then pass some new ones. And the new ones is just to get rid of it, period. And you're right. There needs to be a federal action. But in the meantime, and in between time, it's up to us, you all as mayors, to protect your kids and do everything you can do to protect your kids from big bad tobacco.
And I think that's the big call to action. I am now remembering, I was in Columbus last year, I do remember about that resolution, but the FDA has basically had a policy of inconsistent, if not barely ever, enforcing their own rules. And so one call to action is we really need to come down hard and push the FDA. Second, we know that big tobacco is actively engaged as we push or try to push the White House and ultimately the FDA on, for instance, the menthol issue. They're fighting back on the other side, so now we're in a pause situation. The big tobacco is actually trying to convince the White House. Check this. The tobacco industry is actually trying to convince the White House that somehow black people are not going to vote in the upcoming election if menthol is banned in cigarettes. That is their argument. I don't want to get into it. We're a nonpartisan organization. I'm not getting into politics. But this is a current, active conversation that is now wrapped up in a presidential election. I have never heard such bullshit nonsense in my life. In my life. You know, I made a commitment this morning to myself that I was not going to curse. That I was the moderator. I was supposed to maintain, but
It's all right.
I just being myself. I'm from Philly. I mean, So, and cities and counties and states, we cannot wait for whatever the federal government may ultimately do or results of elections. Our kids and our citizens are dying and getting hooked from these products. And so my philosophy is always, I'm going to do what I can do with what I have to do with it and hope and pray that other people do the same. If everybody does their part, local, state, federal, every tool, every resource, every action that we can possibly take, push the FDA, push the White House, push the city council, push the mayor, push the county commissioner, the county executive, whoever it is you have to work with and deal with, get them to do something on this issue. Ladies and gentlemen, the best panel ever. Please recognize folks here.